My name is Dr. Thomas Kauffman. I'm a general dentist in Atlanta, and I've been practicing since 1978. Around 2009, we obtained a cone beam machine, which is a three-dimensional image that dentists have become more reliant on in terms of diagnosing the needs that our patients have. About this time, about 2009, I became acquainted with an ENT group, Piedmont ENTs, and I began working with primarily one of their partners, Kingsley Chin. But over the course of the last 7 years, I have become familiar with and I have worked with everyone in that group. Karen Kauffman, John Jarbo, Chet Rollins, John Coleman, and of course Kingsley Chin, and even their PA, June Lin. They are an incredible group. They each have a separate area of interest and focus, but it is terribly comforting to send patients there without having to worry about how they're going to be managed, the quality of the care they're going to receive, and also the degree of attention to detail that they get. In my line of work, in seeing the images, and we have just recently become IAC certified, and this is a really big accomplishment in dentistry. We're the 14th practice facility in the United States that have become certified in cone beam imaging, and so I happen to know a lot about this imaging and how it relates to the sinus issues that many of our patients have. Many of these patients are asymptomatic, and so during the course of a week, probably I'll end up seeing at least 1, 2, maybe even 3 patients, as we did last week, that we send to this group. And I primarily send to the area of interest that each practitioner has. John Coleman is wonderful in terms of more traumatic and injury-related damage. Karen Hoffman is a wonderful resource for inner ear and cochlear implants. Kingsley Chin, of course, is probably one of the best people I know about airway management and also the ability to do allergen testing and coordinate this. John Jarbo is the voice box expert over there. Chet Rollins is also a general practitioner in ENT that can handle all of the issues that any of these patients have. So I've been lucky to have been able to engage them and to be able to become part of their team as they have become a big asset in our team. One of the things that I've been amazed at that many times people don't realize is that the average person that is diagnosed with some type of a sleep disorder typically is referred to a sleep physician by their primary care physician. And they then have a sleep study ordered, and following the sleep study, they're probably prescribed a CPAP or perhaps a dental map appliance. The problem with this approach and the difficulty that patients receive this kind of approach is because nobody does an exam on these patients. These patients can be as much as 75–80% obstructed, and the typical path of referral from a primary care doctor to a sleep physician totally eliminates the endoscopy and the approach to physically examining these patients. So I can tell you, the masters of the airway really are the ENTs, and they should be the one that's driving this bus and determining exactly what is the appropriate sequence. It really does patients disservice if there's absent an endoscopic exam, and certainly imaging that will diagnose and determine if there are upper airway issues. It would make sense that if somebody's sinuses are 75–80% opacified, that surely that's going to affect their ability to have air throughout their night's sleep and certainly be able to sleep effectively. So it's imperative that any patient that has a sleep disorder really needs to consider seeing an ENT, and I will tell you this group is outstanding in their ability to provide that service to patients. The other thing that sets this group apart is their ability to use very much cutting-edge culture and sensitivity having to do with the types of bacterial infections that patients have. The typical way that one would have their sinus cultured is we take a sample with a cotton swab and it's sent off to culture out on agar plates. And it's a basic kind of culturing and sensitivity testing that's been done for years. They are, however, utilizing a much more accurate and much more state-of-the-art way where they'll look at the actual RNA or the actual genetic makeup of the bacteria that are involved in the infections. And they have the ability to not only determine specifically how much of the infection, they have the ability to determine within the infection how much is specifically related to a certain bacteria. It makes for a much more effective process. It makes for a much more targeted approach to these patients. The other thing that this group is really attendant to and on top of is the ability for them to coordinate allergy testing. And the other part of their practice, which is so on target, is their ability to involve infectious disease physicians in the course of treating these non-resolving sinus infections. Where I get involved in the cases that they refer to me are those patients that have had one, and I've had patients that have had as many as 8 endoscopic sinus surgeries. They have realized, and I will tell you, there's not too many ENTs out there that have picked up on the fact that patients that have non-resolving infections, particularly in a unilateral infection, are more than likely related to a dental problem or an odontogenic problem. So we get involved in these cases, and they send patients to us on a good deal of regularity because they understand more than just about any other ENT that I've ever run across the importance and the significance of having a dental specialist involved in analyzing and really being a service to these patients and picking out those areas of pathology and disease that a dentist can figure out and bring to the table. As I said, I've been working with every one of these specialists for now probably going on 8 years. I have received probably 300 of their referrals. I probably referred 500 or 600 patients to this group. They have a seamless process of integrating our patients. I send patients to them with a great deal of confidence. I can tell you that in my experience, and I work with several ENTs in this city, but there is no group out there that I would trust more to handle the specific care needs of my patients. You are not going to find any better care for any of your patients from any other ENT group in Atlanta.